Question, Baroness McIntosh of Pickering.
I beg leave to ask the question standing in my name on the order paper and declare my interest with the Dispensing Doctors Association.
The government recognises that growing the GP workforce is challenging, particularly in light of pressures from the pandemic. There are over 1,400 more full-time equivalent doctors in general practice in March this year, compared with March 2019, showing that there is some movement in the right direction. But we do need to go further, and we're working with the NHS England Improvement, Health Education England and the profession to boost recruitment, address reasons why doctors leave and encourage them to stay or return to practice.
I'm grateful for that answer, but my noble friend will be aware that by 2030 we'll be facing an acute shortage of GPs as more doctors leave the profession than join. There are 9 million people living in remote, rural, coastal and island communities, and that's more than actually live in London. Will my noble friend ensure that all health policy is rural-proofed and that those living in rural areas have equal access to healthcare as those living in urban areas?
Well, no, Baroness, my noble friend makes a very important point, and I know my noble friend referred continuously throughout the Health and Care Bill to the practices in rural areas. And we do know that when we look at the challenges, we do know that when you've asked GPs on surveys, there are problems about reduction of working hours, there are administrative burdens, there are some stress and burnout, there's some issues about equitable distribution as well. And one of the things we do have is the Targeted Enhanced Recruitment Scheme that was launched in 2016, and that's attracted hundreds of doctors to train in hard-to-recruit areas by providing a one-off financial incentive.
My Lords, in 2017, the House of Lords report recommended that the current model of small business model of primary care is not fit for purpose. Same has been said by the Royal College of General Practitioners who produced a report, the British Medical Association, the two think tanks, Nuffield Trust and King's Fund, and more recently Policy Exchange produced a report, Fit for Future. Is it not time that the government has plans to look at future models of delivery of primary care? And if the government does not have such an intention, would the noble Lord the Minister agree that the House of Lords should set up a select committee to follow on from the excellent report produced on NHS in 2007?
Well, can I thank the noble Lord for that question, but also explain to him that I have been warned for exceeding my powers, as it were, in the past. I think that's a bit beyond my powers to set up a select committee. What I would say, and noble Lord and I, and in fact many noble lords from across the House, including previous health ministers of all parties, have had this conversation, which is we do know that the old-fashioned model of a 5 to 10 minute appointment with your GP, only to be referred elsewhere and into secondary care, is broken in many ways. And what we need is a much more modern model. We've seen primary care take on some of the functions of secondary care, but we've also seen at the GP level that the GP doesn't have to do everything, and there are other workers like nurses, physiotherapists and pharmacists who can do more of what the GP has done in the past.
What the figures show is that more than half of GPs before the age of 60 are considering retirement or are retiring. And as the noble Lord has pointed out, there are lots of reasons for this. But he hasn't told us what he's doing about these reasons. What is he doing constructively to change the attitudes and the experience of GPs which leads to this disillusionment with men who are at the highest point of their career when they're the most useful in primary care to patients?
I should assure the noble Lord that the government is doing lots of things. Not only is the government listening, it is also looking at potential solutions and discussing them with the relevant bodies. So, for example, one of the pressures that was mentioned was the impact of the number of phone calls and handling that and getting those redirected appropriately. There has been investment on that, and GP practices have been offered money on that. The other issue is about pensions, and some GPs are worried about taking a hit on their pension if they come back to service. There are discussions about whether they are really worse off or not, and how we can retain staff, and also by having more other staff at the GP level who can take on some of those functions that GPs don't necessarily need to do. It could ease their workload. In addition, the administrative work burden has added, and digitisation of the service should solve a lot of those problems.
My Lords.
My Lords, the Royal College of GPs reports that since 2019, GP clinical administration tasks have risen by a shocking 28%. And GPs say that if hospital consultants could refer patients directly to other consultants, rather than patients having to come back to GPs and then be redirected, that would make a significant difference. And the back office functions for repeat prescriptions takes an ever increasing amount of their time. And GPs are not in control of either of these processes. So as a matter of urgency, will the Minister investigate how to reduce some of this bureaucracy so GPs have more time to see their patients?
As part of the joint NHS England Improvement and DHSC GP bureaucracy review, there is such a thing, we've been working across government to reduce unnecessary bureaucratic burdens. And there have been a number of key work streams, including a new appraisal process, digitisation, the sign of some notes, along with work to reform who can provide medical evidence and certificates, and also who can provide notes to nurses, occupational therapists and pharmacists and others. They're continuing to look through the process, engage with GPs to see how we can remove more of these administrative burdens.
My Lords, I understand, my Lords, that looking at wider health workforce issues, that we need another 2,000 radiologists in the next 5 years, and it's very highly unlikely that we're going to produce them. That's the pessimistic note. On an optimistic note, I heard recently that Apollo, the large healthcare provider in India, in partnership with the Royal College and the GMC, have trained up 150 radiologists, high-quality radiologists, every year, some of who are coming to this country. Can the Noble Lord the Minister tell me if he approves of such schemes and whether the department is doing more work in the areas of places like India where we can recruit high-quality medical staff?
Well, can I thank the Noble Lord for the question, but also pay tribute to the Noble Lord's commitment to tackle racism in our society. And one of the important things about this, we do know that there are countries that train more people than they have places for in their country, and they do that for one reason. One is to help those people get a better life elsewhere, but also remittances are much better than foreign aid to many of those countries. One of the sad things is whenever I mention the fact that if you look at who saved public services after the war, it was immigrants from the Commonwealth who saved this country. We should remember that, and we should continue to encourage people from the Commonwealth to come to this country. Sadly, for some reason, Noble Lords quite often don't want them, and they make up all sorts of excuses for trying to block non-white people from outside Europe.
My Lords,
Conservative,
my Lords, one of the reasons that disincentivise both men and women GPs is the quality of accommodation. They're in overcrowded buildings. There's a good example in a care commissioning group in my own area which spent £1 million planning a new centralised health centre which would have provided top-of-the-range facilities and would have encouraged general practitioners to remain in practice. So would he look at this question of the quality of accommodation, what plans there are to introduce new buildings? Because I think it's a really important factor in dealing with the shortage of GPs.
Yeah. Well, the Noble Lord makes a very important point about the fact that GP practices themselves are evolving. Some are moving premises, some are merging onto larger premises, some are actually moving into primary care centres, where they're able to offer not just the traditional GP services, but some of the services that secondary care currently offers. I'm not entirely sure of the specific point the Noble Lord is making, so if Noble Lord would be welcome just having a conversation, I could follow up with my department.
My Lords, does my noble friend agree that numbers of GPs, increasing numbers of GPs, are preferring to work part-time because they face a marginal tax rate of 62% on earnings over £100,000? And would he consider discussions with his friends at Her Majesty's Treasury to address these anomalies in the tax system?
There are a number of reasons why some GPs prefer, and in fact other health professionals prefer to have work part-time as opposed to full-time. And one of the questions we often get is many people, given the stresses for the pandemic as well, do want a better work-life balance. Now, some people have suggested in the past that we should focus on full-time equivalent. What we should be doing is making sure that current staff who want to go from full-time to part-time are able to do so within the system so we can retain them, while making sure that we tackle all the barriers to retention as well as recruiting more GPs.
My Lords, the appointment system isn't working well for GPs or patients. Health Watch England is reporting that complaints about GP services are rising, main problems being difficulties getting an appointment, extortionate waits on the phone, about which we all know about, and an end to online facilities to book slots online. So can the Noble Lord the Minister tell the House what assessment has been made of the detrimental impact on people struggling to access GP services, particularly those who are more vulnerable? And what is the plan to put this right?
Well, the Noble Baron is absolutely right, and we do know that for many people, their first entry into the system, or their portal to the system, if you like, is trying to get an appointment with their GP. As Noble Lord Patel mentioned earlier, the fact is, we have to look at how we modernise this service. In the short term, we've made money available for telephony services to help improve and triage people who phone up services, and also how to manage incoming calls and outgoing calls. In the future, we're looking to more digitisation, extending the functionality of the NHS app, so people in future will be able to book their appointments for all sorts of services, but also if they're waiting for an appointment, they'll be able to see how, or secondary care, they're able to see how long they will have to be waited and where they are in the queue.